Hey, this is to you respiratory therapists, students who are getting ready for the exams. I get this question a lot. How long should I study? And they also ask, how many hours a day should I study? What they're trying to determine is how long it takes to study the Lindsay Jones material, which, I'm Dennis from Lindsay Jones. I'm also on RT Sensei, so I do a lot of courses. And they want to know, do they need 5 months or 6 months or 2 months or 1 month? And how do they know when they're ready for the examination? And I just have a couple of study tips for you. One is that it's okay to study virtually every day. I personally think it's a good idea to study 5 days a week, but not 7, because you need to let your brain rest. But here's the important part. Personally, I think you should not study more than 2 to 3 hours a day max. And that might mean that you take a couple of months to study all the material and get ready for the examination. But one thing that we have found is it might feel like to you that you can study for 8 hours a day. But what we know, of course you're individual, but generally speaking, you might be reading things, but you may not be retaining things. So after about 2 to 3 hours, your retention goes south. You can still read, you can still be there. It feels like you're learning, but you may not be. And we don't want you to have the false sensation that you're learning when you're not. And so my best advice is study 2 to 3 hours a day. If you're studying Lindsay Jones, you probably need about 80 hours of study, depending on how much you know. So you guys can do the math. You probably want to have a couple of months, about 2 to 3 hours a day, sometimes a little longer. Some of you can do it a little less. But if you can do that, that would be my best advice in getting ready for any of the NBRC examinations.